All right. I have an honest question for you. Who here has a bladder problem? Tell me if you do. Tell me if you do. Well, I have to be honest with you. I am no longer 25, and my bladder doesn't act the way it did when I was 25. So if you've noticed changes in your bladder function, you are in the right place. And welcome to tonight's Facebook Live. Hello, I'm Dr. Michael Gorman. I'm the founder of iMove TelePT. Thank you for being here tonight. This is our Thursday. Welcome to the community interview. And these are all about you. So please, please, please be interactive. Ask questions. Give me the heart sign if my guest or I say something great. I'm not sure if you can give a fist bump. I don't know if that emoji is an option, but if you can give me a fist bump, a thumbs up, let's please be interactive. And as always, I ask you guys to please let me know if you're on. And then let me know as well if you have questions. So our guest tonight, we're very, very honored tonight. We're very honored. Our guest tonight is Dr. Brooke Kalisiak. I'm going to bring Brooke in, and I want you all to welcome Brooke to the community. Welcome, Dr. Kalisiak. I'm so happy you're here.
Thanks for having me tonight.
Absolutely. We have been friends for, I don't know, a long time.
Yeah, long
time. I admire you. I respect you. You're a private practice owner here in St. Louis, Missouri, and you are one of the most, if not the most respected women's health or pelvic health physical therapist in this community. So you have done a great job with your career, and we're very grateful that you're here tonight.
Happy to talk with you. Thanks for having me.
Absolutely. So I have a question for our community. As you know, I like to ask questions. So my question tonight is, did you know that a trained physical therapist can help you with bladder issues? Yes or no? Yes or no? Did you know that? And I'm going to look here. Please let me know if you're on. Hold on one sec. Technology, I love it. Hold on just a sec. Oh, shoot. Okay. Anyway, let me know, please, if you knew that. Now, you don't want someone like me trying to help you with your bladder problems. If you have a spine problem, I'm the one for you. But I want to know if you knew that. So let me know. Give me a yes or no, please.
I'm guessing if we get people to answer, we'll get a lot of no's.
Yes. So Tom's on and Danielle is on. And let's see. Ron is on. So Ron is my father. I have to be honest. I would tell everyone that. And Ron is basically, he has a very bad back.
Uh-oh.
So he always wants to know, can she help me with my spine? So maybe you can answer that question real quick. Can you help him with the spine as a pelvic health therapist?
Well, I mean, sometimes stuff, if we're not getting better with the usual route with things going on with your spine, there can be a pelvic component to it, but that's probably not the first road to go down to try and figure it out. But oftentimes we find when we are working with patients who have bladder leakage issues and who also happen to be dealing with back pain, that their back issues seem to be getting better as we get their bladder issues better too. So it can be related.
Very, very true. I would 100% agree with you. Ron, we answered your question. Julie's on. Julie is a physical therapist from beautiful Montana. I've never been to Montana, but I can imagine it's a beautiful state. Have you ever been to Montana, Brooke?
I have. I've gotten to go skiing out in Big Sky, Montana, and it is gorgeous.
Nice.
There.
So Julie says yes, she knew that a trained PT could help with bladder issues. I hope she knows that. And Danielle said yes. And the answer is absolutely yes, but you want to go to the right person. That's why you're not talking to me about this, but we brought Dr. Kalisiak on. So Anyway, welcome everybody. Give me just a sec here. Let me take this piece of paper down. So, truth be told, I have some technology issues sometimes, and I tried something new tonight. And well, forget the iPad. We're going back to the iPhone. So, anyway, so I'm gonna see question. Crazy. All right. So 5 questions for Brooke. We always bring a great guest on, and because we want you to share with us your knowledge, your passion, and how we can essentially get people healthier.
All
My
right.
first question to you is let us know about your educational journey and what, tell me what led you to be a pelvic health or a women's health therapist, and then what does that mean? Because
Yeah.
most people probably don't know.
Yeah. And honestly, I had no idea what it meant when I went into physical therapy school, and that I didn't know what that pelvic health or women's health physical therapy was actually a thing. I thought I'd work with athletes. I was an athlete growing up, and had some injuries, had to work with physical therapy, and got the chance to kind of see that rehab side of it. And I loved the idea of helping people get back to doing things that they love. And so that's what got me into physical therapy. And then I went to Washington University here in St. Louis, and they have some wonderful pelvic physical therapists there that I got to learn from. And so I kind of got an introduction to women's health physical therapy. And I always knew I wanted to open up my own practice. When I came out of school and was working in the outpatient orthopedic setting, I realized that there was a huge hole in the St. Louis market where people were not getting the care and the education that they needed as it related to their pelvic health. And I wanted to create a place where women, men, children who are dealing with pelvic issues could get the education and help that they needed. And so that's why I created my practice. And if you saw my credentials after my name, I'm a WCS, which means I'm a board certified women's health physical therapist, which just means I went on and got extra training and took a long test to make sure that I knew what I was talking about as far as working with things in the pelvic field.
And so does I get a little bit confused sometimes, but that's not surprising for those that know me. Is a women's health therapist, is it changing to be a pelvic health therapist? And do you treat men?
Yes. So our profession, our group is going through a name change process, basically. And I think pelvic health specialist better encompasses. So for a long time, we've been known as board certified women's health physical therapists, but that really is a misnomer because, everyone has a pelvis and can have pelvic issues. And like I said, I work with men, women, and children who are dealing with various things related to pelvic conditions. And so I would say the vast majority of my patient population are female because they tend to have more pelvic issues, but guys can have pelvic pain or bladder leakage issues as well, or bowel issues. And the same thing goes for kids too. So I think that's why our particular national organization group has kind of switched away and is going literally just this past year, switched to the pelvic specialist name. So everyone's getting used to changing over from that. So
do you find that men are less apt to come in and see you because they're too proud?
Not necessarily too proud. I think part of it is just the education that we get about our bodies, and that women are a little bit more open and have had that area of the body poked and prodded a little bit more often than guys are. So they're a little bit more familiar with potentially terms like Kegel exercises and what their pelvic floor is and that. And so I think unfortunately a lot of guys are completely caught by surprise with that. And a lot of the practitioners that they go to, if guys are dealing with pain especially if it's pain in the pelvic area, I've seen guys who have gone to 5, 6, 7 different urologists and been told that they have, prostatitis issues over and over again and put on different antibiotics. And it was really a musculoskeletal issue all along. And so I think, unfortunately, if guys get passed around the medical system quite a bit if they're dealing with a pelvic pain issue. So.
Right. Okay. Well, thank you. Thank you. My next question is, and we could probably talk about this forever, but what are normal bladder habits?
So, there's always a variance, but a lot of people have no clue what's normal for a bladder. But you should be able to take in a I use the word normal again, a normal amount of fluid, and urinate about every 2 to 5 hours during the daytime. And if you're under 65, you really shouldn't have to be getting up at night to urinate. Once you're over 65, maybe getting up once a night. Once you're over 75, getting up maybe twice a night is normal. Okay. And when I say normal amount of fluid, everyone's like, what is that? The eight ounce glasses of water a day? And like, for me, it's different for every person. And I usually tell people to go by the color of their pee, that your first pee of the morning should be a bright yellow. It should be a long pee. And then after that, your pee color should be pale yellow the rest of the day. So if it's a dark colored yellow and you're not peeing for very long, you're dehydrated, you need to take in more fluid. And if you're peeing clear, you can probably back off on the fluid that you're taking in too much right now.
How about coffee?
Oh, coffee. So coffee is, especially the decaffeinated version of it, is one of the biggest bladder irritants for a lot of people, unfortunately.
Now, did you say if it's decaffeinated?
No, if it's caffeinated.
Oh, gosh. Brooke,
decaf still has a little bit of caffeine in it, but it's the caffeine and it is the acidity of coffee can be quite an irritant for people. So a lot of times if you're dealing with urgency and frequency issues where you're having trouble making it to the bathroom in time or getting really strong urges or going really often throughout the day, looking at what type of fluids you're taking in can make a big difference. So coffee, soda, tea, any of that caffeinated stuff really can do a number on your bladder, and simply backing off of that and switching out some coffee for some water can make a big difference for a lot of people.
Okay. All right. So it's not like you should just drink 64 ounces of water a day and you're fine. That may be not enough, and that may be too much perhaps.
Yep. Kind of depends on the person. That whole like one size fits all 8 ounce glasses of fluid doesn't work for everyone. So
okay. Okay, good. Anything else there are normal bladder habits?
So one of the things that people a lot of times are surprised about is that when you go to pee, you should be able to just sit down. The pee comes out. You shouldn't have to push. You shouldn't have to strain. And you should be able to have that stream going for a good 10 to 15 seconds. So especially if you are a mom of a little one, honestly, you get like no time to go to the bathroom, and they come in and they quick and they sit down and they push as fast and try and get it out as fast as they can. And that's actually really not good habits for us. And that can put a lot of extra stress and strain on the bladder. So we are designed to sit down and relax and let the pee happen. We're not designed to have to push to create it to happen.
And so what happens, not saying it would happen to someone like me, but what happens if you, if it's not a steady stream for 10 to 15 seconds? That seems like a long time, but
it does seem like a lot of time, long time, but for a lot of people, they're either, and if they're not getting that, they're either peeing more often than they need to throughout the day, or they're not taking in as much fluid as they need to throughout the day. And so they've just gotten used to, a lot of times when people have situations where they can only go to the bathroom at certain times and so they're kind of very regimented with when they can pee. I work a lot with some counselors who, like, I see a client every hour and I've got like these little windows that I can get to and go to the bathroom. Then they're going to have a harder time kind of creating that longer stream and that with it. So
wow, I'm learning. All right. So our next question is, so tips that you have for people dealing with bladder problems.
Yeah. And there's a whole host of different bladder problems that can range from leakage. So leakage is anytime bladder or urine's coming out when you don't want it to be coming out. So, and this is anything from a few drops to, Niagara Falls, quite honestly. So some people think like, oh, I just leak a few drops when I sneeze. Like, I don't have bladder leakage. That's normal. And I was like, no, it's not normal. Any type of urine leakage coming out when we don't want it to be is not normal. And there's something that you can do about it. As it relates to leaking when we cough or laugh or sneeze, that's probably one of the most common things that a lot of women will see and it's called stress urinary incontinence. And one of the recommendations I can give with that is what's called the NAC. And it's just, if you have warning that a cough, laugh, or sneeze is coming on, stop in place and try and contract your pelvic floor muscles, or you might hear that referred to as doing a Kegel exercise. You want to think about kind of pulling your pelvic floor up and in like you're trying to stop the flow of urine, basically you're getting those muscles ready to accept the load that's going to happen from a cough, laugh, or sneeze. And so you're kind of prepping them ahead of time. So if you have warning that a cough, laugh, or sneeze is going to come, stop, contract your pelvic floor, and that a lot of times can stop you from having that leakage to happen. Okay. Other problems that people experience with their bladder is oftentimes urgency or frequency. So urgency is where we get this kind of almost uncontrollable, strong urge to go to the bathroom. And it's happening, it can, for some people, happen quite frequently. And it can lead to urinary frequency, that we feel like we're going to the bathroom more and more often. You know, like I said, people should be able to go every 2 to 5 hours between urination. And so if you're going every hour, you're dealing with some urinary frequency issues. And so if you're finding that you're having trouble getting to the bathroom in time, or you feel like it's just, you're really needing to go there often, one of the tips I can give is just to stop and take some really slow, deep breaths in and out. And when we take these big, deep breaths, it has a calming effect throughout our entire body, but it really has a calming effect on our bladder and can bring down that urge a little bit so that it feels like you can get there in time. And it can even sometimes, you know, if you know you just went to the bathroom 30 minutes ago and you're feeling the urge to go again, sometimes just sitting still and taking 5 to 10 deep breaths can actually get that urge to go away so that you can go back to doing what you need to be doing.
So here's a question for you. Can a lumbar, a low back herniated disc cause one to have bladder problems?
Yes, potentially. Yeah. So if we've got back issues that are affecting some of the nerves that are coming down and supplying into the pelvic area, it can lead to or contribute to some bladder issues. So yeah, I've definitely had people where we've had to look higher up the chain and see what's going on in their back, and that to make sure that everything's working the way it should be.
So that's a tip for anyone on this live that has back problems and is seeing a physical therapist. They need to ask you during the evaluation, do you have any bowel or bladder problems? That's a big one, because that points us in the direction that there could be a disc issue compressing a nerve or irritating a nerve. So, all right, I'm going to take a quick break. Let me see who's on. So I already said Tom. Danielle's on. We already said Ron. We answered his question. Julie, Michael. So Michael's Michael, you may be the founding person that joined my pain-free golf group, but Michael's going to be my guest next Thursday. We'll talk about that in a bit. So, okay. Next question for you. Next question. All right. So how do people know if they need to work with a pelvic physical therapist? Like what, I guess my question would be, what kind of symptoms would I be having that, okay, it's time for me to seek care? And then how do I know I'm going to the right physical therapist?
Yeah. That latter part's probably the easiest part. And so one of the ways that you know if you need to see a pelvic physical therapist, how do you know if you're finding the right one? And so honestly, that needs to be a question that you're asking of the place that you're calling. That do you have a trained pelvic physical therapist? And I'm a board certified women's health physical therapist or pelvic physical therapist. I have the initials, the WCS, after my name. And so that's the highest level of kind of board certification that we can get in our profession. So that's one way to know that, okay, this person is up to date on everything and is a good pelvic physical therapist. There's also something called a CAP certification, which also comes from our national organization, which just means that you have gone through the training of all the various coursework in that as well. So first and more, just making sure that when you do call that you're asking, like, do you have a pelvic physical therapist on staff? And it is the first thing, so that you're not necessarily just getting placed with any orthopedic physical therapist and it's someone more specific to the pelvic world. But how would you know if you need to? Some of the most common diagnoses that I work with are people dealing with bladder issues. So if you have any type of bladder leakage, whether it be stress incontinence, when you leak with cough, laugh, or sneeze, urge incontinence, when you get the urge to go and you can't quite get to the bathroom in time, or you know where every bathroom in St. Louis is because you know you need to go to the bathroom like every 30 minutes to an hour. You're the annoying one on the family road trip because you're making everyone stop like every 30 minutes. room. Those are all signs that, there might be something going on with your pelvic floor and your bladder. And there's things that you can do often that are very conservative in nature to make a difference on it. Other things that pelvic physical therapists often are working with are women or men dealing with pelvic pain issues or pain with intercourse. Also with females dealing with something that's called pelvic organ prolapse, where our insides get to start to fall outside, which is a whole nother discussion. But
Yeah.
And we see a lot of women during their pregnancy and postpartum time to work on core strengthening and support and making sure that their pelvic floor muscles are doing what they need to be doing during pregnancy and delivery and beyond. And that's so any of those kind of symptoms or timeframes of life are common times where it may be beneficial to be working with a pelvic physical therapist.
That brings up a question. What should a pregnant woman exercise?
Oh, heck yes.
And for how long? I know you should explain, but like what time frame should you be maybe cutting back on the exercise, or do you just continue to do what you've always been doing?
That's a really loaded question. And the benefits of exercise during pregnancy are huge for both the mom and the baby. So it's definitely a time where you do want to be active, but it really depends on what you're doing ahead of time. Like if you've never ran before, you don't want to start a running program when you're pregnant but if you have been a lifelong runner and that's your normal routine then many women can comfortably run through their pregnancy. If you haven't been very active or exercising, I do recommend working with like a pregnancy or a fitness specialist so that they can design something specific for you. And I usually recommend doing more gentle, low impact things, but that it does include strength training and flexibility. As far as when you need to cut back, most women need to start to make some modifications to their routine starting in the late second, early third trimester, just depending on how they feel with what's going on. But again, it's really individual to what your body can do. I've read some studies where they've been looking at, high level female athletes who are competing, almost at the professional level, or if not professional, and how they kept up with their training programs throughout their pregnancy and, did great with it. But, that program wouldn't be something that someone who'd never worked out could pick up in their pregnancy. And so it's really very individual to the woman.
And then, this isn't a formal question that we have, but which I know we could talk about this for a long time and you don't have to get too specific, but what would a normal treatment be like if a man or woman comes to see you? I know you don't know until you do your evaluation and determine what the real cause of the problem is, but what's normal?
Yeah, and I'll back that up to actually the evaluation itself, because a lot of people are unfamiliar with that. But when someone's coming in and to get treatment for some type of pelvic condition, we first start out at our practice talking with them about their symptoms and what's going on. And then we look from the outside in. We look at the whole body and how people are moving. So we start out by taking them through some different motions and different positions to get a sense of how strong and flexible and coordinated the muscles are, oftentimes focusing in around the pelvic area. So abdominal muscles, hip muscles, back muscles, buttocks, how all of those guys are all kind of coordinating together. And then the second part of the evaluation, and what people may not be aware of, is that we specifically evaluate the pelvic floor muscles, and the gold standard for assessing the pelvic floor muscles is similar to a gynecological evaluation for females. It's a single digit insertion into the vaginal canal to assess where the muscles are resting and how well they're contracting and relaxing, and again, coordinating together with other muscles if there's any scar tissue or issues going on to evaluate all that. Now, ultimately, it's the patient's choice, and if that's not something that they're comfortable with, there are other options that we can do, but that really gives us the most information as far as what's going on with the pelvic floor, so that we can set up as detailed a program as we can to help them out.
Fantastic. And how many times would you, on average, would you see a patient that had pelvic health issues?
Honestly, with pelvic health issues, a lot of it is related to patient education and things that they can be doing on their own to kind of change it. So it's not it's not like post-op rehab where, you know,
Right.
you're someone 3 times a week and to make sure that, you know, we get their shoulder moving well. And that really, we usually see people once a week in the beginning, and then for maybe about a month or so, depending on what's going on with them. And then at that point, we're kind of spacing it out a little bit more to see if they can kind of progress on their own. And so we're typically seeing people for anywhere from maybe 4 to 6 sessions, just depending on how severe their issues are. So,
wow. A lot of great information. A lot of great information. Thank you so much. My last question, as everyone always knows, is I want to know what mantra you live by. So what's your saying that you live your daily life by?
That it's actually carpe diem. It's how I sign every email that I have, and it's up in 2 or 3 places in my clinic. And so for those of you who don't know, it means seize the day. And so we've got every day is a gift, and we've just got to go with it and see what we get out of it and just make the most out of each day. So I've lived by that since junior high. I had a junior high basketball coach who always used to say it, and it stuck with me. So it's been there for a long time.
Do you know, here's a little trivia question. What movie did Carpe Diem become famous in?
Dead Poets Society.
Dead Poets Society. Very good. Do you know who starred in Dead Poets Society?
Robin Williams. It's one of my favorites.
So good. I can't get anything past you.
It's one of my favorite movies. So you got me on a good one. So I love the part of the movie where they quote, oh, what was it? They're quoting Walt Whitman, I think, and he reads like "suck the marrow out of life," and
for sure. All right, let me look and see if there's any questions. Please, if you have a question for Brooke, let me know. And hopefully I'm getting all the comments that are coming through. We do have Tina that joined. Thank you, Tina, for joining us tonight. So right now I don't see any more, but if anything comes through, I will for sure get that over to you, Brooke. I want to leave everyone your contact information. Brooke is the owner of Legacy Physical Therapy in St. Louis. Mm-hmm. And that is her website and her email address. And I'm pretty sure if you email Brooke a question, she would be very happy to answer. And she's a phenomenal individual and has helped so many people in the city and beyond. But that is her contact information. Brooke, would you like to say anything else?
No, I really appreciate you having me on. And I know a lot of people, once they realize that pelvic physical therapy is even a thing out there, and they start to wonder if they're appropriate, that a lot of times they do have questions. So please feel free to shoot me an email. I'm happy to try and answer any questions that you have and be a resource to point people in the right direction.
Awesome. Well, I want to thank you for coming into our community tonight and educating people on a topic that probably a lot more people need to be educated on. So thank you for your time. Have a great rest of the night and have a great weekend, Brooke. I'll talk to you soon.
Sounds good. Thanks, Mike.
All right. Take care. All right. That was awesome. I knew you guys would like that. Brooke is just a phenomenal person and one of the smartest people I know personally. Thank you for joining tonight. Don't forget that we are doing, for iMove TelePT, we're doing one Facebook Live a week now, and that is every Thursday night. We're doing the Welcome to the Community interview next week. As I talked about earlier, we have a very special guest, one of our loyal followers, Michael Niemuller. Michael is incredibly smart, not only with pharmacy, but he knows every music trivia question you could ever throw his way, especially if it's about the 80s. But Michael is a pharmacist, and I wanted to bring him on to talk about different over-the-counter as well as prescription medications that are out there that can help people. What are the different kinds out there? What does an NSAID mean? So I'm going to be bringing Michael on next Thursday. He's been very kind to agree to join. So he'll be on next Thursday at 7 p.m. Central. And don't forget, if you are a golfer or if you have a friend that is a golfer, please get them over to my Pain-Free Golf group. We do Tuesdays, 7 p.m. We do a Facebook Live for that. And even if you don't like golf, we talk a lot about health and good education to keep everybody healthier, more mobile, stronger, all those good things. So thank you for being here tonight. Grateful for all you guys for continuing to watch. And if you need me for anything, please reach out and stay home and stay strong. Have a great weekend. Take care.